In the heart of Kogi State, life moves on with quiet resilience. But behind the scenes, many families are battling an invisible threat: tuberculosis. Tuberculosis continues to affect thousands of lives across Kogi State. Despite years of awareness, many people still live with symptoms for months or even years without knowing what's wrong. By the time they get a diagnosis, it's often too late or too difficult to treat. And for many, the distance to the nearest testing center is a barrier they can't afford to cross. The Association for Reproductive and Family Health, in collaboration with INGRA and the State Leprosy and Tuberculosis Control Program, is taking TB screening and HIV testing directly to the people through Community TB Active Case Finding Project. With support from the Global Fund, the project targets one goal: finding the missing TB cases and offering testing and treatment right at the community level.
Tuberculosis is a chronic infection that affects the lungs and also other parts of the body. But the more on the one that affects the lungs, which we call pulmonary tuberculosis. So it's more. And all of them can be cured. And the treatment is free. We have free drugs, free tests. For 6 months you are done. Then the sign and symptom is coughing for 2 weeks or more, night sweating, fever, difficulty in breathing, and so on and so forth.
Through strategies like house-to-house visits, contact tracing, and outreach camps in hard-to-reach areas, the project is leaving no one behind. The outreach strategies are simple yet effective. But one of the impactful developments so far has been the introduction of the portable digital X-ray, the PDX machine. The PDX machine is a portable TB diagnostic tool that is revolutionizing the way testing is done. Before now, samples collected during outreach had to be taken to labs, sometimes hours away, and results could take days to return. Since the PDX rollout, community outreach and house-to-house screening have been more than just awareness activities. They've become diagnosis points, life-saving intervention that close the gap between symptom and care. Since then, they've been integrated into outreach activities, house-to-house screening, and even facility-based testing. Community members are responding with trust. More people are stepping forward. More cases are being detected early, including in children and older adults who might otherwise be missed.
I'm so overwhelmed seeing them coming to my domain for the X-ray to help us check each and every one of our community members, not for anything but for our own good, for our health. Health is wealth. So we are so overwhelmed. I'm very, very happy seeing them taking this exercise in my own community. My community benefited a lot, because when you talk of health, you talk of everything. Because it's with the health that you can be able to go to market. It's with the health you can be able to go to farm. It's with the health you can be able to go to work. It's with the health you can be able to go to anything in life. So when government come to care about your health, you should always embrace, because just as I said in the first place, our health is our wealth.
We appreciate you people, in fact, for the patience and the work that you people have done for us. Our people are happy, the communities are happy. They are benefited so far because many of them have come down, knows their health status. They know the condition of their health, and that is the most benefit, because our health is wealth.
I can say, because the tests they have just run for me now is number one benefit. Because if I am to go to hospital to run it, I will pay. But here now it is free, so it's a huge benefit. Because some of us cannot afford to do this kind of test, but we thank them for bringing us to our doorstep.
I am very grateful for what is happening here. I was just passing by and I see that something is happening here. I have to come, and they check me and they say I'm healthy. I appreciate God. I will say the organizers are, in fact, they are doing well. They continue to do well.
I bring with thank God to share. May God put out any medicine now give us. May God put out, may it work for us.
I'm so happy that they do this test to me now.
I feel it well, and then they test me. They say I'm okay. So I thank you people, and I thank my God.
God will help them as they help me. God will help them back.
We are happy and we are glad to see that there is actually a body that care about the health and welfare of the people in the society. And I want to commend the effort of whomever put this together as a program, that God will bless them and reward them. Because like myself, I've been able to benefit from this, and I also want others to benefit.
Stakeholders in the state confirmed the impact. The PDX has improved turnaround time, reduced loss to follow-up, increased the number of confirmed TB cases, making TB screening more effective. Health workers are now more confident in the field, and patients are more likely to start and complete treatment.
It has improved case finding, it has improved the outreach component of the case finding in the state, and it has also provided a greater boost for more participation of people in the community in the ACF activities. One of the things it has done in terms of results, it has improved the ability to reach the hard-to-reach communities. When it comes to the granular data, you find out that the PDX machine, 4 of them were received in the state in December, and December marked the end of the 4th quarter in 2024. A comparison, quarter-by-quarter comparison of presumptive and cases in the state between 2024 quarter 4 and 2025 quarter 1 shows a great marked improvement in case finding. Precisely, you find out that in the presumptive TB cases for quarter 4 2024, we had about 12,670, while compared to 2025 quarter 1, we have 24,243 presumptive. That accounts for about 191% increment. And then for the diagnosed cases, you also see serious marked improvement. While we had about 1,184 cases diagnosed in quarter 4, we have 1,917 diagnosed in quarter 1 2025, which is about 62% thereabouts. So in a nutshell, one, programmatically we've been able to reach more communities, we've been able to reach hard-to-reach communities, we've been able to test more, but also we've been able to get more presumptive, identify more presumptives, and like I said, the quarter-to-quarter comparison, we see a 191% increment, and the cases diagnosed has also improved. So that quarter-to-quarter, we are seeing about 62% increment.
The screening is necessary. Initially, we don't have why we don't have a genius X-ray machine. We go to community. The turnout is very low, but with this X-ray, people see what are they doing here? They will come and say they are doing chest X-ray. The chest X-ray in the other hospitals they collect money, but this one is free. So with this, the turnout is higher than the normal way that we are doing with ordinary drugs. So at least with this, we are able to get more number of cases through this chest X-ray screening.
But the challenges still remain. Rural communities still struggle with poor power supply. Transporting the machines and ensuring they are maintained takes a lot of coordination. And scaling these successes to all corners of the state will require even more collaboration and resources.
One of the teething challenges we had was that of utilizing the machines to its fullest. By that we meant that the number of outreaches that were planned, the number of outreaches that were conducted, and so these were some of the challenges that we had to grapple with. But this it's a work in progress, but a whole lot of progress has been made. Specifically, the radiographers have been working very well with the lead CBO, INGRA, as well as the sub-CBOs to plan out outreaches prior to the month. So for the month of June, for example, the plans for the communities where outreaches will be held are already being made. For the month of May, the plans were made late in April, So this is an improvement as to what happened maybe in previous months, whereby it was almost looking like it was on the go. So one of the challenges is proper planning for the outreaches. The challenge of the movement of the machines to the various locations has also been resolved. It was a challenge, but it has been resolved as there's dedicated car vendors, car hire vendors rather, who are dedicated to ensuring that the machines, the radiographers, the data clerks, and even a member of the CBO are moved from their locations to the locations where outreaches are being held. So that has become more seamless, more smooth, and it has also been quite effective.
Still, the commitment on ground is clear. Community volunteers, health workers, and program officers are pushing boundaries, not just finding cases, but changing lives. Whether it's walking under a tree, beside a motor park, or in a classroom, the mission is still the same: fighting against TB in Kogi State. In every local government, every ward, from crowded markets to remote villages, the story is changing. People are no longer waiting for care. Care is coming to them.
Yes, I expect definitely to see that the testing, the matrix, the cascade for the ACF will show marked improvement, especially in terms of the number screened, number reached, the presumptive identified, and even the cases diagnosed. So I expect to see an improvement in quarter 2, even compared to quarter 1.
The introduction of PDX machine has given the new momentum to the fight against TB in Kogi State. Every household reached, every child tested, and every case detected brings us closer to a TB-free Kogi State. With innovation, partnership, and persistence, we can win the fight against TB and end the TB epidemic in Kogi State.